There are lots of complaints that I have about the food industry in the United States, but one of the things I love is healthy convenience. This is a protein shake. It does not need refrigerated. You can take it anywhere quickly and get 30 grams of protein in this little shake. In dental sleep medicine, convenience is just as important. If you put hurdles and obstacles in a patient's way before they can make key decisions like, should I move forward with sleep test? Should I move forward with treatment? I'm willing to pay this deductible to have this treatment. If you're putting all kinds of obstacles in their way before they're even coming in for a consultation, you are removing the convenience and you're going to reduce the chance that they are going to move forward with treatment. So look at your workflow with a real close eye and see how you are making efforts to make it convenient for the patient to come into the office, get to know you, establish a relationship so that they can move forward with treatment.